Transparency and a knowledgeable, engaged consumer is part of the invisible hand of the marketplace, meaning that you've got a lot of competitors, no barriers to entry, and you've got a smart, knowledgeable consumer. That is the case in every other industry. I always use a big screen TV. Number one, those keep getting cheaper because you're applying technology to it. And there are individuals where I live that would drive 50 miles to save 50 bucks on a $1,000 big screen TV. They may have just offset the cost of the savings by the travel, but they do it. None of that comes into play in healthcare. Look at the grocery store. You go down the aisle to save a few bucks shopping for groceries. That's competition. That's transparency. We need that in healthcare. That's why we got a broken system, because it's run where no one knows what it costs until they 3 months later get the bill in the mail and they hope it's not going to send them to bankruptcy court. Bad way to run it. And it's a shame we'd even have to do things like trying to get rid of non-compete clauses, where there's a way to restrict the flow of doctors. Doctors and nurses were some of my biggest supporters in the campaign because they're tired of being in a corporate world of big insurance companies and big hospitals. Many of them had to sell their clinics to the hospitals to get through all the red tape. All the things we're doing, we shouldn't have to be legislating to get it done. I was with an insurance group here earlier today telling the same thing. Why don't you help me by starting to loosen the grip of no transparency or plans that don't work, and explaining that if not, it's likely to become a one-payer system someday. Keep going after the big players. Make sure they're doing nothing other than what all other businesses do. Tell us what it costs, educate us as consumers, quit doing it behind closed doors. I'm going to try to get that to change.